it says to make quality, affordable health care available to all Americans, reduce costs, improve health care quality, enhance disease prevention, and strengthen the health care workforce. So politically and socially, how can anyone be against legislation that provides for the welfare of its citizens?
Well, I think the Affordable Care Act does address all of those components. You know, a healthier population, lower per capita costs, better health outcomes, providing training for more doctors and nurses so we make sure people have access. And when you ask people, do you support those factors? Do you support, you know, making sure that fewer of our kids smoke and they lose weight so they are not developing chronic health conditions? Do you support having parents who don't have to worry if their child has a pre-existing health condition that they will never have insurance? Do you support getting rid of companies who can dump people out of the marketplace? One at a time, folks are overwhelmingly in favor of the features of the bill. I think, unfortunately, there has been a lot of misinformation and intentional misinformation. Everything from seniors being told that there were death panels that somebody in government would choose who lived and who died. Could not be further from the truth. People told that the federal government was taking over the insurance system. Absolutely wrong, false. So what people oppose often are elements that really are not part of the bill in the first place. And that misinformation has been driven by everything from radio and television advertisement to constant drumbeat of talk shows who continue to give bad information to folks. So I really appreciate the opportunity to talk about really what is part of the law, because when we talk about what's part of the law, stronger Medicare that lasts into the future, training more doctors and nurses, changing insurance rules so that we get rid of pre-existing condition limitations forever. And folks with a health condition, about half of our population, don't have to worry that they will be locked out or priced out of the insurance market. When you talk about those features, people really like the fact that we're going to have a new healthcare system in America.
Do you find that people come to this, and I'm talking about just average citizens, with more emotion as opposed to, you know, rational thought associated with those things that you just said?
Well, I think healthcare is very personal and it's very emotional. People relate to their own situations. You know, what happened to me in the hospital stay? What was my experience with my doctor? And if someone says to you, you like your doctor? Yep. Okay, this bill is going to change that. That frightens me. And I think that kind of disingenuous exchange has been part of the underlying problem. There is no federal takeover of anything. In fact, this is a very state-based strategy, knowing, you know, I'm a former insurance commissioner, so I know that at the state level, providing that consumer information, having an opportunity for people to pick and choose their own coverage, having an opportunity for patients to choose a doctor is really important, and that's really what the underlying features are in the bill. So it is emotional, it is personal, but we hope that people visit sites like healthcare.gov and get some factual information. You know, here's what's in place now, here's what's happened in 2010, here's what's coming in the bill, and here's how it can impact you.
A number of folks have kind of looked at this or termed this a defining type of piece of legislation in the Obama administration. Why is this so important to the Obama administration?
Well, I think it's important to the American people. Presidents, Republicans and Democrats, for 70 years have talked about transforming, reforming our health system. And it starts with the basic look at what the status quo was. We spend more than any country in the world on healthcare services, and yet the health results, how healthy our citizens are, looks like we are not spending nearly enough resources. So we've got a real disconnect between the amount of money that's spent and going up every year, each and every year. We're spending more and more. We're now at about 1/6 of our overall gross domestic product spent on healthcare. And yet we really don't compete with other countries in terms of how long our citizens live, how many babies die in childbirth, what the rates of obesity are, what the rates of chronic disease is. So we needed to change the status quo. And presidents, again, Republicans and Democrats have tried to do that. The passage of the Affordable Care Act in March of 2010 was the first major health reform bill since Medicare was passed 45 years ago. And it will set a new platform aimed at a healthier population, lower per capita costs, and better quality care for everyone in the future. And that is a big defining moment.
Now, one of the other things that you guys have said is that this would actually save the American public, you know, $1 trillion over time. How do you arrive at that?
Well, again, those are not my numbers. This didn't come out of the Health and Human Services folks or out of the Senate or the House members who voted for the bill. There's an organization called the Congressional Budget Office, nonpartisan, works for Republicans and Democrats. They're kind of the green eyeshade guys. They're the accountants, and they look at not just the health care bill, but pieces of legislation, and they score it. They put either a cost, this is going to add money, or it's going to subtract money. And what they have said is that if we are indeed successful at slowing down the growth in healthcare costs, which are part of the strategies here, if we indeed are more efficient with the use of resources, if we can stop the overpayment to insurance companies for some of the things we're paying for, if we introduce competitive bidding for some of the drugs and equipment that we get, all of which are part of the bill, we indeed will save $1 trillion over the next 2 decades. That's a lot of money that won't be added to the deficit. Not only will we save that money, but the health care bill, the new features, making sure that there no longer will be co-pays for preventive care, making sure that seniors now will have a wellness checkup as part of their annual Medicare benefits, you know, getting insurance products more available to folks, setting up these new exchanges, private insurance plans who will compete. That's all paid for along the way. So not only is there not a cost added, but $1 trillion is saved.
So we get better health care, we become, you know, physically healthy, and we save money at the same time. This is almost unbelievable.
Well, it is, and a lot of people say, I don't believe that's going to happen. But again, it is not our data that shows that. It's the Congressional Budget Office. And right now, about 75 cents of every health dollar spent, 75 cents is spent on treating chronic conditions. People with diabetes, people who have congestive heart failure, who go in and out of the hospital, often see multiple doctors. And we spend about 8 cents of every health dollar on any kind of prevention and wellness. If we can indeed convince folks that they need to eat healthier diets, do a little more exercise, take off some weight, not have so many obese and overweight people, which is underlying cause of a lot of chronic conditions. And if we can cut down the rate of smokers and particularly stop kids from smoking in the first place, we will have a huge impact on that 75 cents of every dollar. I mean, we will begin to, and the better news for the country is we'll have a more prosperous workforce. We won't have as many sick days. We won't have as many workers who actually can't do a full-time job because they're coping with an illness. So it's not only better for our healthcare economy, but it's better for the national economy.
Let's talk about your critics. Who are some of your biggest critics when taking a look at the Health Choices Act?
Well, I think that unfortunately, the bill as it traveled through Congress got very partisan. So at the end of the day, we had some Republican support on the Senate side. We had very little on the House side. And I think, unfortunately, there were members of Congress, and some of the leaders made this very clear from the outset, who knew that President Obama had campaigned saying he was going to actually introduce changes in the health system. He felt it was important for all Americans to have access to affordable care. He felt it was important to look at the huge cost increases year after year, and this would be one of the first things he would tackle. There were people who were not enthusiastic about him being elected president who said, we are going to basically fight this from the beginning. So it really didn't matter what was in the bill. It was that there was a health bill proposed, that the president was going to propose it, and I think, unfortunately, some folks said, we don't even want a conversation about it. We're just not going to help. We're not going to participate, and we're going to begin to talk right now about how bad it is before the bill is even written, and that's exactly what happened.
So in your conversations with the president, is he somewhat despondent at this point related to this bill, or is he more angered by the fact that Congress hasn't taken a real decent leadership role in making sure that this happens for the American people?
I would say he's actually pretty excited and sees this as certainly a challenging time until the bill is fully enacted. So until the new health exchanges, which are kind of the new insurance marketplace, is up and running in 2014, we're kind of gradually making our way toward the full implementation of the bill. And he recognizes that there are challenges along the way, that, you know, a lot of people want it to happen a lot sooner, are still not quite sure what it all means, but that we have crossed a very important threshold. Signing the bill, having Congress, the House and Senate actually vote to put it in place is a huge step forward. And so we're working hard on implementation, and each and every day, I think, as people begin to connect with benefits, I can tell you, I talk to parents all the time who have had a child graduate from high school or college who would have been uninsured absent the ability to keep that adult child on a family health plan. Those parents know that there's a good feature in the Affordable Care Act. Seniors know now that they have an annual wellness checkup and are enthusiastic about that. They know that this year they're going to see a 50% decrease in the drugs they purchase in the so-called donut hole. You know, they run out of their insurance coverage. That's a huge step forward. That's thousands of dollars in people's pockets. So as the benefits begin to kick in, as parents who have a child, I can't tell you how many moms and dads I've talked to who literally are in tears because they were terrified that their child would never be able to buy health insurance because of a condition, a childhood condition where the child is now well and healthy, but looking into the future, they say, you know, we were looking at a situation where I would be constantly terrified that he or she would never be able to be covered. And this law will change that forever. We'll never have to have a situation where people with a pre-existing health condition, and that's about half of our population, have to be afraid that they can't leave their job, that they can't retire, that they can't make a choice that's good for them and their family because they are so desperate to have the health care they need to stay alive.
One last question.
The Speaker of the House and the new freshman class have been talking about cutting spending, and they've also been talking about repeal. Are there some areas of the bill that need to be repealed? They're talking about repealing everything. What are your thoughts?
Well, the House new majority passed a measure to repeal the bill. It went to the Senate. The Senate voted to keep the bill in place. I would really love to see us come to the table and work on areas which need to be improved, but not refight the battles of the last 2 years. Let's not go backward, let's go forward. So for instance, there's a provision, the so-called 1099 provision, which is going to require small business owners to fill out lots of forms. It is clear that there is more burden than benefit with that specific provision. The president has said for the last 8 months, let's get rid of it. Let's work together. The Senate has passed an elimination of 1099. We'd like the House to do that soon. It's exactly the kind of example of this is a comprehensive bill. There will be features that can be improved and changed along the way. So let's get together and make that happen. Let's, you know, move forward together. And that's really what the president has invited the members of the House and Senate to do. Let's work together on making the bill better. You know, Medicare today looks nothing like it did 45 years ago, but it set a platform that said never in this country will we have senior citizens without health insurance. You know, when you think back 50 years ago, 2/3 of America's seniors had no health coverage at all. they were terrified about getting sick. If you had resources, you could pay out of pocket. If you didn't, you were really out of luck. That was changed forever with the passage of Medicare, and every year we improve Medicare. The same thing can happen with the Affordable Care Act. We have said, finally, everyone should have access to quality, affordable care. We're going to make sure that insurance companies no longer get to pick and choose who gets coverage, but everyone will have access to a new market, a new strategy. And we're going to work with healthcare providers to improve the health of all of our population.
Glad you could stop by to see a clip from KTWU. It's your input that helps make public television great. Consider a donation. Browse over to ktwu.org right now.